Hello, namaste, everyone. And again, it's a brand new day, and we have someone very special joining to us for the Postpartum Global Series talk. And she is someone from Slovakia, and she is Lucia Jelinkova. And she is an expert, SHEN expert, traditional Chinese medicine expert, practicing there since many years. And Lucia and I, we met in 2016, years ago in Beijing, China, during some, the training programs. And we have been friends from that time. And it's really great. And I'm so glad to reconnect with Leah again, being she's a very sweet, beautiful woman. And now also having two kids and raising them so nicely, both of them. So I think this will be a great discussion, not only based on the part of professional side, but also Lucia will be giving her own inner insights during this postpartum series talk. This is the second episode for the season 1, and we are now beginning our show. And welcome, Lucia, once again. Heartily namaste.
Namaste. Thank you for your invitation.
Yeah. So, Lucia, I think it has to be informal. It has to be spontaneous, and it has to be natural. I don't want to frame it in a very particular way. So, how was your own experience of postpartum with the latest baby?
With the latest baby. Yeah. With Dashka, I gave birth like 10 months ago. Actually, she's 10 months today. And actually, I have a great experience, to be honest. Because first time I gave birth in our country in a public hospital, and the experience was not maybe what I expected, because the staff in the hospital they were not very supportive to me, and the labor took like a very long time. It was maybe like 23 hours, a lot of pain without any analgesia. So, but then after all the pain, one of the most of the beautiful moments in your life came when you see your own baby. So I already forgot about all the trouble. But this time with Dashka, I gave birth on a private clinic, and it was very nice because the clinic is surrounded by trees, and the doctors and all like birth assistants, they were very supportive to me. It was maybe only like 7 hours or 6 hours. My husband was there, and it was a great experience for me this time. Like I was much happier.
Much better, much better.
Much
So
better.
how overall, what are the practices that you people practice there immediately after postpartum? Yeah, are there any specific things that you do for your labor, maybe to ease out the labor pains, apart from the anesthesia that is given medically? And also, are there any other factors that you look, like the food, like any particular type of exercise or any type of act you do before, like for a good labor? And also, what are the general traditional practices that Slovakians do immediately after the birth of the baby?
Well, like during the pregnancy, there is not maybe like very specific dietary advice, besides like we don't eat raw meat or sushi, or we don't drink ginger tea or minced tea, because we believe that it could lead to miscarriage. Like we are trying to eat very nutritious food, but like I wasn't doing like anything so super specific, during pregnancy, just avoiding things that could harm the baby. And after I gave birth, during the postpartum time, the food was maybe a bit different. Subhadra? So,
I am here. Continue, Lucia. I'm here.
okay. because I cannot see you, even me. It's okay.
Yeah, no
There's
problem.
no sound in
No
the camera.
problem. No problem.
Yeah.
No problem.
Uh-huh. So after I gave birth, it was a bit different because I was, you know, trying to get full recovery. And in our country, the woman is drinking grape juice to promote lactation. So I've been drinking a lot of grape juice or grape apple juice. We are eating egg soup with the cumin. That's
Oh,
also
wow.
very traditional.
Yeah.
Yeah, and my husband was cooking that for me. And we are eating a lot of meat.
Okay.
So
For the
yeah,
purpose of
so that's
protein.
just
Yeah.
yeah.
Mm.
So this is like a couple of dietary advices or our some like traditional things, but the preparation for the labor was, in my case, this time a bit different compared to my first labor.
Okay.
Because I wanted to be like more calm. Because first time I was very like stressed out, and like this time I really didn't want to, you know, undergo this stress again.
Yeah.
So
It's quite natural for the first pregnancy to be more anxious, and it's quite natural for everyone. And because the second delivery, you have a certain set of experiences for yourself, and you also know like this is going to happen next after this, next after this. So you are a part, though the pain is already too much to bear, but still you have that experience that helps you inside that, yeah, this is the process, and this much I have to tolerate at any cost.
yeah,
So,
yeah.
yeah. So yeah, it's good to know about the certain set of foods that you told that you avoid, Slovakians avoid, so that we don't go through the abortions or miscarriages. That's a beautiful thing to know. Are there any activities like you are not allowed for certain set of activities, like no heavy lifting, no heavy weight lifting, or no vigorous exercises?
Like yeah, we shouldn't carry anything like heavier. That's, I think, around the world like, in general. But I think that when I was talking to other women, they've been exercising a lot
Yeah.
compared, for example, to Chinese medicine, where we shouldn't exercise
Yeah. Too
almost
much.
too much during
Yeah.
pregnancy. In
Yeah.
our country, I think the women exercise a lot. They doing pregnancy yoga. Like that's fine because
Yeah.
this is
Yeah,
something
sit
different.
and brisk. Pregnancy yoga is somehow, yeah, it's like more
This must be
lower.
specific
Yeah,
exercises
too
for
much
labor. Yeah,
intense
yeah, I know.
exercise is obviously not entertained. Yeah, in Ayurveda as well.
Mhm.
Yeah.
Yeah. So if there is not any problem, like the women are in our country, like in general, like allowed to exercise even during the pregnancy. Yeah.
Yeah, yeah. The body consciousness or the way you look is really quite important for most of the people of modern times.
Yeah, yeah.
Yeah. So,
But I wasn't, for example. Thank you.
so after that, so you delivered your baby, and how many hours you were in hospital, and after what, how much of time you were allowed to go back to your home, and what are the first thing you did? Were there any customs or cultures they are accompanied? Like in India and Nepal, we have a lot of things like that. We have an event, a ceremony to celebrate. You put on some stars to the baby, and the mother is welcomed in a certain way. So, can you explain something about your country? Yeah.
Oh, that's so nice when I hear those things. Because in our country, like we are staying usually 3 to 5 days in the hospital
Okay.
with baby.
Even today, even if it is a normal
Yeah,
delivery, even if it is a normal delivery.
yeah, yeah,
Oh,
yeah. 3 to 5 days.
okay.
Even I was 5 days staying in hospital.
Yeah.
And then the woman is coming home, and you know, in ideal case, she's surrounded by her loving family and closest friends who are
Yeah.
taking care of her, of course. But it's very individual. It depends if you have this family or not.
Yeah.
But I think that, and then the postpartum time in our country is usually 6 to 8 weeks.
6 to 8
After
weeks.
this time, the woman should be fully recovered.
Okay.
But in my experience, it's not like that. I think it's
Yeah.
much longer. I would say 3, maybe even 4 months. That's the time the woman needs, you know, at least for this recovery, because
Yeah.
6 weeks is not enough.
Yeah, 6 weeks is like half a month, 1.5 months, and I think it's nothing. And
Yeah.
because there's so much to recover in so much of individual levels of your body, your mind, your emotions, your sleep, your pattern, your pre-pregnant pattern. It's a big, it's a huge. So I
Yeah.
want to know what is the official status of Slovakia? How much, like, even if a woman is a government, government employee, or any or she works elsewhere, how much time she gets as a holiday
Mhm.
after she delivers a baby?
If the woman is government, so like employee, she can stay for 7 months on maternal leave.
Okay, so maternal leave.
But the women are staying home since 34th or 36th weeks until the baby is like approximately half-year old.
Yeah.
So she's staying like full 7 months with the baby, and she has money, like she would go in and work, like she has like her normal you know what I want to say.
Yes, it means that for 7 months,
Sorry.
yeah,
I
for
couldn't read.
7 months they get a paid
Mhm.
leave. Even they are not
Yeah,
working, they will
baby.
get the
Yeah.
paid leave.
Mhm.
It is happening both in the government setups and also in the private setups, wherever the lady is working.
Yes.
Okay, yeah.
Also in government and also in private.
Yeah, that's quite good. 7 months, it seems to be
7
a
months.
good time. Yeah, yeah.
Yeah.
Yeah, because like 6 months of exclusive breastfeeding, baby also gets that time with the mother, and also like
Mhm.
6, 7 months is a good time to recover. And maybe
I
I
guess.
also, yeah, some of the people prioritize their own things. There are a few people I have seen, they wish to go to work earlier, and this seems to be their own individual choice, not a set of rule
Mhm.
that a country has imposed. It's their own individual.
Mhm.
Like in Nepal,
But actually we have
I say you, in Nepal, like we have like 3 months of paid leave, and we can
okay.
extend that leave to 6 months, 3 + 6
Mhm.
months, but the 6 months is without leave, without pay. So
Without pay.
yeah,
Okay.
yeah. So for 7 months, you are getting the payment, and also you are getting the leave. That's quite a good thing.
But in our country, we have a possibility, not a possibility, it's like in general, that we can stay in, even I'm staying now until 3 years of the baby at
Yeah,
home,
uh,
taking care of the babies.
yeah.
And it's called in our country like parental leave.
Wow. Yeah.
And we are getting paid not much money. It's like around 500 euro nowadays.
Mm-hmm.
But you can stay with the baby, and it's your choice. If you can go back to work or not, even the father can stay with the baby. That's
Yeah.
also like great
For the both
possibility.
sides, open for the both side.
Work on both sides, and even the father can stay on maternal leave for
Wow.
those like after the woman gave birth, the father can stay with the baby and get paid his salary, for this time. So mother can start work right after she gave birth. That's the possibility, yeah.
Yeah.
But
This,
I'm staying until Dashka's gonna be 3 years. Yeah,
yeah, it's very
with her.
interesting that these laws and these laws and these things are addressed very differently in all the countries around the world. There's
Yeah.
not a similar type of
Because in US,
culture.
I heard that, yeah, because in USA, I heard that the woman, they can stay only 3 months with the baby, and they have to go to the work again, just 3 months.
Yeah, 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 like for 9 months I heard in United Kingdom, UK, and
Uh-huh.
yeah, it's also like around like 9 or 10 months. So it's different according to the policies of
It's
the
hard for the
country.
women because if you want to breastfeed the baby,
Yeah,
it's very hard to go back to it.
yeah. On the other hand, we're talking about a healthy generation, about setting some good goals for the baby's health. And in the other hand, you are not really cooperating with the policies that are helping the mother. Then that is really not going to help in a big screen. Yeah. So Leah, I want to discuss more about the food habits are like a little bit what you told me about the grape juice and a lot of meat. Yeah. I think is there anything more delicacies that are prepared at home? Yeah, some of your mothers, or because where I'm sitting and talking, it's like we have a very close customary familial bondings and the communal bondings. Even the people from the community are bringing out things like cooking by themselves. We are in a very different setup. Yeah, we're in a very different setup.
Yeah, obviously.
To discuss. But is there any delicacies, more other delicacies, like more sweet things are allowed at this time? More sweet type of dishes are prepared and encouraged for you. Is it something like that, or it's always about the soup, the protein soup, the juice?
I think that even, for example, my grandma told me, now you can eat everything you want. Everything sweet. You can eat everything you couldn't eat before because you were scared to gain some weight. But I don't think that in our country is like something so specific, besides the egg soup or the grape juice or the nutritious food. But this is not very like traditional in our country that we have like some, yes, this food.
Have you ever talked to any woman of your grandmother's age, like who is in 80s or 90s, and she might have ever shared, yeah, we used to do this type of things in our time during the postpartum. Is there anything that you'd love to share and you have ever discussed?
Actually, I think the women during 70s or 80s, it was much harder for them, the postpartum time, because my grandma, she had to go work 3 months after she gave birth.
Oh, yeah.
Like in US nowadays.
Yeah.
Yeah. And the baby, and I was asking like, and okay, you start working in where you gave the baby, and there was like very special like kindergarten for the baby, for very small babies. And the woman, they put the babies in the kindergarten, go to work. And when you imagine such a small 3 months old child, and you put it away from you, and my grandma told me that it was heartbreaking for her.
Yeah.
She was crying every day, but they didn't have any chance because, during the communist 70s or 80s, that was like communism in our country. And the people, they had to work. So that's unfortunately in any cost. So unfortunately, like my grandma, when I was talking to her about the postpartum time, she said it was a very sad time for her. Because she remembered, like she was trying to put her baby away from her.
Okay.
So compared to the past nowadays, I think that's much better.
Much better. Okay.
Yeah, much better conditions for women.
Yeah. Okay. So so it seems like historically or traditional things are quite less practiced over there, or maybe there was so much of social changes in and off in between, like in the political level, so that there was not.
Yeah, in our country all the time, even now.
Yeah, that's why it was not really possible to carry out the cultural or the traditional things in a row.
Yeah. Like, because I was asking my grandma, like during the postpartum or 6 or 8 weeks, like what she was doing. And she told me that she don't even remember this time.
Yeah.
Anyway, yeah. So I'm not sure if she actually was doing something, traditional, what your mother was doing. She said, she told me she don't remember. She doesn't remember.
Yeah. So in your own postpartum time, was there any time, any low time that you felt like we talk about these days we talk so much about postpartum depressions, postpartum blues. So any of the things that you personally faced, or it was a very good journey for you?
Well, first time with Lianko, it was 5 years ago. When I came home, I was not prepared that the baby is gonna cry so much.
Yeah.
Because first 3 or 4 months, Lianko was suffering on baby colics.
Yeah.
And I couldn't help him because he was not able to fully digest the breast milk.
Yeah.
And he was crying so much. It was maybe 8 to 9 hours per day. And I think that I was a bit depressed during this time.
Yeah.
Because even other people, they couldn't help me. And even the doctor, she said, oh, that's just period. You gotta just survive, you know, that. And it was very hard for me because I wasn't prepared for that.
Okay.
And Dashka also suffered on colics, but not that much as Liamko. But I already was, you know, mentally expected that something like that can happen. So the postpartum for me was a bit like tough, but also I think it can be like one of the most beautiful time in your life.
Yeah.
You know, getting intimate with the baby, like suddenly there is new person in our apartment.
Yeah.
Something awesome, yeah.
Different zone in your heart is like activated, and
Absolutely.
that's a different level of
Yeah, and it changes your
being a mother.
personality, it changes
Yeah,
everything in your life.
it changes everything. Yeah. So,
So for me, it was a bit hard because the baby boost, yeah, and nowadays it's a big topic. Um, but I think that the women, they should ask for help, you know, during postpartum. Because I think even my friends, they want to do everything on their own. They want to see like, they want to be seen as a superwoman.
Oh,
But I think there is, that's so hard to raise the kids, especially when they're very small. And the women, they shouldn't be ashamed
asking
for
for help.
asking help. Yeah.
Yeah.
And even I was like that. I didn't call anyone to help me.
Huh.
But now with Dashka, my mother-in-law, she came for 1 week in our apartment and she was helping me. And that was such a relief when I could, you know, put my baby in her arms, at least for a while. Because first time with Liamko, I was alone, just with my husband who was working. So I was alone with the kid and the kid was crying. So yeah, I was,
Yeah. Most of the time, we women, we are really trying to be a superwoman, and that is
Yeah.
quite not necessary most of the time. The first thing that needs consideration is our own health, first of all, and after that, many things come after that. But I don't know why we have burdened ourselves so much with like we can do this also, this also, this also, this also. No, please stop doing this. We have a limit.
Because
We
we're
need to
doing,
understand our limit, and it's good to understand your limit. It's being kind to yourself. Yeah.
yeah, and that's very hard, especially nowadays, because we are doing full-time, like being woman is hard. We are doing full-time job in our household. We are cleaning, cooking, take care of the babies. And many of my friends are also working, you know, even I am working a bit like from home with baby. And yeah, as you said it very, very nicely.
Yes.
We should be more kind to ourselves.
Yeah, yes. So Lucia, also I wanted to know that once the baby was having the colic, was there anything that you were doing on your own at home to manage it besides the medicines of pediatrician? Or is there any way traditionally that are taught to you people to make it work?
Like about the colics,
Yeah.
how I was treating the colics for baby. Actually, I was doing acupuncture
Yeah.
to my baby, but it's not traditional in our country because me as a
So was it
practitioner, I
helping
was
out? Was it helping out to the baby?
yeah, I guess it was helping, but we still had to wait until the baby is like 4 months old to, you know, get rid of it like 400%. But I think that the acupuncture works. Baby belly massages.
Yeah.
That was something what was helping. I got even some special oils for colic. It's even called the oil for baby colics. So I was using it. and doing massages every day, maybe a couple times in a day to Liamko. Then I've been using, but not that much, the rectal tube for baby. That helped, I think, a lot, maybe even more than massages.
Yeah.
And I was carrying Liamko a couple times, a couple hours every day, you know, in my hands, because he was so stressed out and crying. And sometimes, you know, even I had to just calm down the baby in my own arms.
All the healthcare facilities that are available in the country, but these are also some set of problems. And you have medicines, you did everything you can do for your baby, but still that is not managed.
Yeah, and I was
The
giving
gap,
him some
I guess this is a gap.
enzymes for help.
Yeah, enzymes for the health. Yeah,
Enzymes.
because the medicine, set of medicines. So I think this is a little bit of gap because this could have been little bit much better if somebody was like you know, some traditional things that we do in Nepal and India for this colicky pain for the babies. Like we change the foods of mother. We
Oh,
have that
really? Okay.
custom. Yeah. We have that custom that if something is like the, you know, the feces of the baby is turning into different colors, we change the food of the mother. If the baby is crying too much with a colicky type of things, then we change the food, because the milk production, it comes out from the what mother
Oh,
ate.
sure.
Yeah.
Yeah.
So if you are taking too much of like gassy things, it can hamper the baby who consumes your milk. So these are the things that we follow too much here. Sometimes even a
I
doctor,
understand, but
yeah, doctor is like
even my pediatrician told me to avoid some you know, some food what could probably the baby could be gassy from it. But I was eating only like meat and rice and some veggies, but the baby was bloating still. To my baby, it didn't help, but probably, yeah. I know what you mean. The dietary restrictions in case of colics is important. Yeah.
Yeah. So Lucia, I think we discussed a matter where you were talking like in the history, there were women who were feeling postpartum time in a different way. In a sense, like they were set to, or they were like preset in mindseted to think that that is a impure state, and there were different type of curtains. They were like you have given me a brief history of these things. Would you like to share?
Yeah, that was very interesting for me. When I was reading about it. In the past, like until the 20th century, when the woman gave birth, she was considered as unclean.
Yeah.
So, and you know, people in our country, they were poor, and the whole family was living in one room usually. But the woman had to be somehow separated. And
Yes.
since she was considered as unclean, they separated the woman with linen sheets, you know, was hanging from the ceiling as a curtain.
Yeah.
And so the woman can have some privacy with the baby.
Yeah.
But the woman, she couldn't touch almost anything. She couldn't even milk a cow because the cow could lose her milk. You know, the people believe that the woman lost a lot of her strength during the labor. So she was temporarily unable to resist some black magic forces. Yeah. So the woman stayed.
It was considered to be holding such type of energies that can transfer to the cow or anything else you touch.
Yeah, the
It's
black magic
interesting.
could
Yeah.
be transferred to the cow. Yeah, and she could lose her milk. Yeah, and so the woman, she stayed, you know, for the whole postpartum time with the baby behind the curtain, and she had, I think, and she couldn't do anything, so she could get a lot of, you know, recovery.
Rest.
That would be nice even for nowadays if some practice like that, you know,
Yeah.
would be practiced now.
We have to look to both sides of this event or
Yeah.
this historical thing that because of that, maybe creating such type of hypothesis, they were trying to help the woman that she can't touch anything, then she will not be doing anything. But
Well, maybe the people were
yeah,
scared
but
of
also
women.
we can also see how our societies used to perform at that time, how they used to think about that time regarding women and such an important event of life, giving birth to a baby, creating
Mhm.
a new generation. Yeah, but it used to prevail in other countries as well. It's not a very new thing. Like I mean to say, it used to be these things, these concepts were there in our countries as well.
Mhm. Even nowadays.
Was for the purpose of isolating the woman because she is very weak physically, immunologically at that time, and touching anything can, like, she can invite infections in her own body. So
Mhm.
like isolating her from any of the touching and contact points and just being with the baby. That's what also not that bad idea.
Yeah, but I'm not sure the purpose, in the past was to protect the woman. Maybe the people, they want to protect themselves because they believe the woman is now, dangerous for them.
Being a back. Oh my God.
But
Yeah, yeah. It was like till 20th century, right? Till the modern
until
medicine
20th
and all the
century.
internet. Yeah, yeah. 10th
Yeah.
century is
Right.
it's like it means 100, 200 years ago.
Yeah.
There used to be a world like that. Yeah, interesting.
Yeah. Yeah. Mhm.
Yeah. So summing up, Lucia, we are almost at the end of our discussion. Maybe we can again continue someday in some other aspects of postpartum. It was very nice talking to you and also know and understand about the habits and traditions and what are Slovakians really, or Slovakian women really doing about postpartum. I have a brief, interest to know that is there any concept of massage or like you are soothing out the mother also and also babies.
During the labor or during
Yeah,
postpartum?
postpartum.
Uh, Not really.
Not really.
Because women, when she's coming home, we are, staying at home. We are not, coming anywhere to have some massage, or
Outdoors.
it's not very like traditional. But I think that nowadays is getting more popular, something different, and it's called gynecological physiotherapy.
Okay, yeah.
So the woman, right after she, after labor, she undergo this examination, and the physiotherapist see if there's any serious wounds, and how we can prevent diastasis, or if we can help the woman from the like physiotherapy
Part.
look
Yeah.
part. Yeah.
Physiotherapy, you need to like pull up the certain things and the effort is needed for physiotherapy. That is not more toward the relaxation part. Like somebody's massaging,
Yeah.
just like
Yeah.
lying down and somebody's massaging you.
But the physiotherapists do even some massages as well.
Massaging.
But the physiotherapist, because I have my own gynecological physiotherapy, and she was, teaching me some very smooth exercising, what I should be doing right after I gave birth.
Okay.
And
Were they more focused on the pelvic floor area?
yeah.
Okay.
Yeah.
Okay. Yeah. Yeah, that's interesting to know, Lucia. I think for today, we need to conclude this session and maybe we can connect again back to, sometime with some topic. It was great
Yeah.
talking to you, and I hope you also had a great time to let us know, to share your knowledge, so that many people from all around the world can listen to this and understand the basic of how Slovakians are doing that. And someday I will also talk about Nepal and India with some or more experts, and it will also be opened up, and we can see the differences and the good and bad things on either side, and we can incorporate the good things and eradicate the bad things, customary things that are happening, because the main thing is the well-being of a mother and a baby, and we need a healthy baby, we need a healthy mother, and I think there's nothing more or less we need than that. isn't it?
Exactly.
Yeah.
Yeah.
Thank you so much for joining, Lucia. I'm so glad and I'm
Thank you very
really
much.
humbled. Thank you so much. Namaste.
Thank you very much. Namaste.
Namaste.